Good morning, tooth pupils. The tooth teacher is in this morning. Your host, Dr. Z, here with another episode of our Oral Pathology Corner. This week we're talking about a topic that ties a little bit back to our ongoing discussion about dry mouth. It's a pathology called angular cheilitis. And what angular cheilitis is the name kind of refers to the angles or the corners of our lips, and cheilitis referring to inflammation of the lips. So it's an inflammation at the corners of the lips. It's going to look a little something like this. And basically what angular cheilitis is we talked several months back about candidiasis or thrush, which is a fungal infection inside the mouth that can occur for any number of reasons. Now, picture, if you will, those same little fungal critters gathering at the corners of the mouth. Doesn't happen to most of us, but this is usually going to happen in, older folks who, as we all age, as time passes, everything starts to sag a little bit, including the mouths and, the muscles around the mouths. And so a lot of times the older folks, their mouths kind of angled down a little bit, especially if we're missing, and this can affect anybody of any age, but it's going to be especially noticeable for anyone who's missing their back teeth and have lost their, what we call vertical dimension of their bite, which basically means their bite is collapsed a little bit, allowing their face to kind of scrunch in and be the lips be angled down like that. And when the lips are that way chronically, it's going to basically allow a little bit of saliva to kind of drool out of the corners of the mouth and then pool there. And your saliva has got some of those little fungi in there, and because they're pooling there, they have nowhere to go. They're free to just go wild at the corners of your mouths and cause a little localized infection. And that's what angular cheilitis is. So, obviously, fixing that downward smile is a bigger topic, a lot more difficult to treat. But short term, dealing with any kind of localized angular cheilitis infection is fairly simple to treat, which basically just involves a little application of some topical ointment that's going to clear up that fungal infection, make that irritation go away so that patients are more comfortable and that fungal infection can't spread further. So that's basically all there is to angular cheilitis. As always, I hope this was helpful and useful. And if you have any questions or suggestions for further topics, feel free to reach out. Otherwise, next week we'll finish up our topic of dry mouth that we've been discussing the last few weeks, talking about other treatments for other aspects of dry mouth. And until then, I hope everyone has a great week, and we'll see you on next week's Tooth Teacher Tuesday.